All right. Ready to go deep on something you might not expect?
Oh, what's that?
Abdominal exams.
Okay.
You all requested this deep dive, and
Right.
while it may not be everybody's, cup of tea,
Right.
trust me, it's going to be a lot more interesting than you think. We've got this document called Abdominal Top Tips, and it's going to be our guide today
Okay.
as we unpack the techniques behind a really effective abdominal exam.
You're right. It really is surprising how much intrigue there is in a good abdominal exam.
Right.
It's like a window into the body's inner workings.
Yeah.
Like it's amazing what you can learn just by looking and feeling.
Okay, so let's set the scene. Our patient is on the couch. Head of the bed is raised to about 45 degrees, I would
Okay.
assume, like we're ready to start poking and prodding.
Mm-hmm.
But this document says the exam actually starts before we even touch the abdomen.
It does, yeah. It might sound strange, but some of the most crucial insights come from simply observing the patient first. Think about it.
Yeah.
Their facial expressions, how they're breathing,
Right.
any signs of jaundice.
Oh, okay.
Those details can give you a head start before you even lay a hand on them.
So it's almost like detective work, like gathering clues before you even get to the main scene of the crime.
Exactly. And speaking of clues, you might not expect this, but even the patient's hands can tell a story.
Okay.
Think of it as the handshake test. We're looking for things like clubbing of the fingers.
Wow.
It can point to heart or lung problems. Or palmar erythema.
Mm.
That's a redness of the palms that might signal liver issues. Even something as simple as nicotine staining can give you a bit of insight into their lifestyle and habits.
Wow, I never would have thought to look at someone's hands for clues about their abdomen. It's like every part of the body holds a piece of the puzzle.
That's the beauty of it. And while we're on the topic of observation,
Yeah.
we can't forget the eyes and the mouth.
Right.
Checking the eyes for pallor, for example.
Mm.
That can tell you a lot about the blood's ability to carry oxygen. And looking at the mouth for cyanosis,
Uh-huh.
that bluish tinge,
Mm.
might signal problems with circulation or breathing.
So it's not just about looking for, like, any old sign of pallor. There's nuance there, right? Like the specific shade of pallor, or
There's-
whether it's accompanied by other symptoms can point to a more specific diagnosis.
Exactly. It's all about connecting the dots, seeing the bigger picture.
Yeah.
Before we move on to the actual abdomen, there's one more stop.
Mm.
The lymph nodes.
Okay.
These little guys are part of the immune system. And if we find swelling in the supraclavicular area,
Okay.
just above the collarbone or in the armpits, it could point to an infection or even something more serious.
It's incredible how much information we can gather just by observing the patient,
Oh, yeah.
but I'm sure you're itching to get to the main event,
Ah.
the abdomen itself.
Of course. But before we get hands-on, it's crucial to remember that patient comfort and respect are paramount. We always make sure they're lying flat comfortably and only expose the area that we need to examine.
Okay, so we've got our patient positioned, feeling comfortable.
Right.
Now I imagine this is where those deep breaths come in.
You got it. We ask the patient to take those deep breaths to help relax the abdominal muscles. That makes palpation easier and more accurate.
Hmm.
And here's a little trick of the trade. The examiner actually kneels down to get at a better angle.
Kneeling down. Why not just, like, stand and reach over?
It's all about leverage and body mechanics. When you kneel, you can use your whole body weight to gently palpate each quadrant of the abdomen.
Interesting.
It's much more effective than just using your fingertips. It's better for your wrists in the long run, too.
Oh, that makes sense. It's like you're becoming one with the abdomen,
Exactly.
using your whole body to feel for those subtle clues.
You got it.
So what are we actually feeling for during palpation?
We're feeling for any masses, which could be anything from a benign cyst to a tumor.
Right.
We're also checking for guarding, which is when the muscles involuntarily tense up because of pain.
Okay.
And we're assessing the aorta, feeling for any unusual pulsations that might signal an aneurysm.
An aneurysm. That sounds serious. Is that something you can actually feel with your hands?
You can, yeah. It would feel like a widened or strongly pulsating section of the aorta.
Mm-hmm.
An aneurysm is a bulge in the wall of the blood vessel,
Right.
and it can be life-threatening if it ruptures. So catching it early through a thorough exam can literally save a life.
Wow, that puts the importance of a detailed exam into perspective.
Yeah.
It's not just a routine check, it's potentially life-saving.
Exactly.
All right, so now with the basics of palpation covered, let's move on to the liver. This is where things get really interesting.
Right.
And the top tips really come into play.
Yes.
Okay, I'm ready for some expert tips. What's the best way to feel for the liver?
Well, the liver sits up under the ribs on the right side.
Okay.
One of the top tips is to start palpating lower than you might expect,
Mm,
down in the right iliac fossa,
okay.
which is basically the lower right quadrant of the abdomen.
Right.
Then, as the patient takes a deep breath in, you slowly move your hand upwards.
Why start so low? Wouldn't you just want to go straight for the area where the liver is?
It's a common mistake.
Yeah.
But you see, the liver moves downwards with each breath. So if you start low and move upwards as they inhale,
Right.
you're more likely to catch the edge of the liver as it descends.
Okay.
If you start too high, you might miss an enlarged liver altogether.
That's a detail I would never have thought of. It makes you realize how much precision and technique goes into a good exam.
Absolutely.
Yeah.
And to confirm what we're feeling, we use another technique,
Okay.
percussion.
Percussion. That's the tapping.
Right. Yes. By tapping on different parts of the abdomen, we can listen to the sounds produced.
Hmm.
Different densities of tissue produce different sounds. A solid organ, like the liver, will sound duller than an air-filled space, like the lungs.
So by listening to the sounds, you can actually map out the borders of the liver.
Exactly. And that can tell us whether the liver is enlarged, which could indicate a range of conditions.
It's amazing how much you can learn from simply listening and tapping. It's like having a sixth sense, being able to hear what's going on beneath the surface.
Yeah.
So what comes after we've mapped out the liver?
Well, from the liver, we move over to the left side of the abdomen, and that's where we start our quest to find the spleen.
The spleen, that's tucked up under the ribs, right? Is it hard to feel?
It can be, yeah. It sits pretty high up on the left side, under the rib cage,
Right.
and it can be tricky to find.
Hmm.
Here's a tip from the top tips document. Reach further back towards the patient's back than you'd expect.
Oh, okay.
The spleen enlarges towards the right iliac fossa. So if you just feel around on the front, you might miss it if it's only slightly enlarged.
So it's kind of like a treasure hunt, trying to track down this elusive organ.
Exactly. And if we can't feel it with the patient on their back, we might ask them to turn onto their right side.
Right.
That brings the spleen closer to the abdominal wall, making it easier to palpate.
Hmm.
And just like with the liver, we can use percussion to check for any dullness in the area.
So if we hear dullness during percussion, it could mean the spleen is enlarged.
Precisely. And an enlarged spleen can be a sign of a number of things, so it's an important finding. Now, after our spleen adventure, we move on to the kidneys.
Okay, time for the kidneys. Where do we even begin with those?
Well, the kidneys are located towards the back on either side of the spine.
Right.
To feel for them, we palpate the loins,
Okay.
those areas on either side of your lower back.
Mm.
If we feel a kidney, we'll try to gently ballot it,
Ballot it.
pushing it back and forth between our hands to check its mobility.
Interesting. Why is it important to check if the kidney moves?
Good question. Restricted movement could mean there's inflammation or some kind of obstruction.
Oh,
Again, percussion plays a role here.
right.
Tapping over the kidneys can help us identify any tenderness or abnormalities.
Wow, it's amazing how much information we can gather from different techniques. Observation, palpation, percussion.
Right.
It's like we're building a multisensory map of the abdomen.
Yeah.
But before we get ahead of ourselves, is there anything else we need to check for in this area?
There is one more important thing. Ascites.
Ascites. That's
Yeah.
the buildup of fluid in the abdomen, right?
Yeah.
How do we check for that?
Percussion is our friend once again.
Mm-hmm.
We use a technique called shifting dullness.
Okay.
When a patient lies flat, any fluid in the abdomen will settle in the flanks,
Okay.
those areas on the sides of the abdomen.
Mm-hmm.
So we percuss the flanks, listening for a dull sound. Then we have the patient roll onto their side. If there's ascites, the fluid will shift, and the area that was dull will become resonant as the air-filled bowel moves into that space.
So the sound changes as the fluid moves. That's incredible. It's like we're listening to the fluid slosh around inside the abdomen.
Exactly. And to wrap up our abdominal tour, we'll make a quick stop at the ankles.
The ankles.
Yeah.
Going from the abdomen down to the ankles?
Yeah. It might seem strange to go from the abdomen down to the ankles, but remember,
Right. Everything's connected.
the body is interconnected.
Okay. So what are we looking for down at the ankles?
We're checking for edema,
Okay.
which is swelling caused by fluid buildup,
Right.
and looking for any scars.
Mm.
Edema in the ankles could point to a number of things like heart failure, liver disease.
Right.
It helps us connect the dots
Right.
and see if those findings relate back to what we've discovered in the abdomen.
So even something as seemingly unrelated as swollen ankles can provide clues about what's happening in the abdomen. It really highlights the whole body approach you need to take in medicine.
Absolutely. And that brings us to the top tips section of our document, which offers some valuable insights
Yeah, okay.
into the finer points of abdominal examination.
Mm.
It goes beyond the basic techniques and delves into the nuances that can make all the difference in a diagnosis.
I'm all ears. What kind of top tips are we talking about?
Well, we've already touched on some of them, like the importance of starting low when palpating the liver,
Right.
or reaching further back when feeling for the spleen. But there are so many more. We'll dive into those next time.
This has been a fascinating start. I already feel like I'm looking at abdomens in a whole new light. I can't wait to uncover more of those top tips and see what other insights we can glean from this deep dive.
I'm excited to share them. You'll be surprised at how much more there is to discover about the art of abdominal examination.
All right. Welcome back. We're in the middle of our deep dive into abdominal examinations, and I'm already amazed by how much detail and nuance goes into this
Oh, yeah.
seemingly simple procedure.
It's true.
So I'm really curious to hear more about those top tips you mentioned earlier.
Right, yeah, the document's full of them. And they're
Wow.
all about those, little tricks and techniques that can help you get the most out of an exam.
Okay, where should we start?
Well, we've talked a lot about palpation, but proper hand placement is crucial. For example, when you're feeling for the liver, the top tips recommend using a flat hand with your fingers parallel to the costal margin,
Okay.
which is that lower edge of the rib cage.
Why is that specific hand position so important? Wouldn't any hand position work?
You'd be surprised. Using a flat hand allows you to feel a wider area,
Okay.
and keeping your fingers parallel to the ribs ensures you're moving your hand in the right direction.
Right.
Following the natural contour of the liver,
Hmm.
it's a subtle difference, but it can make it much easier to feel for that liver edge.
It's those little details that separate the novice from the expert, right?
Exactly. And the same goes for examining the spleen. Remember how we talked about reaching further back towards the patient's back?
Right.
Well, the top tips also suggest using your left hand to support the patient's rib cage from behind,
Okay.
while your right hand palpates below the ribs.
So it's almost like you're gently sandwiching the spleen between your two hands.
That's a great way to put it. By supporting the ribs from behind, you can lift the spleen slightly, bringing it closer to your palpating hand.
Okay.
Makes a huge difference in your ability to feel for any enlargement.
I'm starting to see how these top tips are like little hacks that can significantly improve the accuracy of your exam.
Absolutely. And here's one that might surprise you.
Yeah.
When you're checking for ascites,
Right.
the top tips remind us that the pleximeter finger,
Okay.
the one you tap on during percussion, should be parallel to the anticipated fluid level.
Why is that important? Wouldn't you just tap wherever you think the fluid is?
Well, you want to be as precise as possible.
Yeah.
By keeping your finger parallel to the fluid level, you're ensuring that you're accurately assessing the shifting dullness.
Okay.
If your finger is at an angle, you might get a misleading result.
Right.
And it also emphasizes the importance of percussing back to the level of dullness after the patient rolls onto their side.
Okay.
That helps you gauge how much fluid is present.
So it's not just about whether the sound changes, but also about how much it changes.
Exactly.
It's like we're using sound to measure the fluid level inside the abdomen.
Exactly. And speaking of ascites, there's another fascinating technique mentioned in the top tips called the fluid thrill.
Fluid thrill.
It's a bit more advanced, but it can be really helpful in confirming the presence of a large amount of fluid.
Okay, what is it?
It's actually quite simple. You have the patient or an assistant place their hand firmly down the midline of the abdomen.
Okay.
Then you tap sharply on one side of the abdomen and feel with your other hand on the opposite side. If there's a lot of ascites, you'll feel a distinct wave or thrill transmitted through the fluid.
Wow, it's like sending a ripple through a pond.
Exactly. It's a pretty cool technique.
Yeah.
And it can be very helpful in tricky cases.
Yeah.
As we're talking about these top tips,
Yeah.
it strikes me that they're not just about improving technique, they're also about improving patient care.
That's a great point. How so?
Well, the more accurate our exams are, the better we can diagnose and treat our patients.
Right.
These little tips and tricks might seem insignificant on their own,
Right.
but they can make a real difference in someone's life.
I hadn't thought of it that way, but you're absolutely right. It's not just about mastering the moves, it's about using that mastery to help people.
Exactly. And that brings me to another important aspect of abdominal examinations. Communication.
Right. It's not just about poking and prodding.
Right.
You need to connect with the patient as a person.
Precisely. The top tips document emphasizes the importance of explaining each step of the exam to the patient
Okay.
answering any questions they might have, and addressing any concerns.
That makes sense. If you're the patient, it can be a little unnerving to have someone, pressing on your abdomen and not really know what's going on.
Exactly. And when patients understand what you're doing and why you're doing it, they're more likely to relax,
Right.
which can make the exam easier and more accurate. It also helps build trust and rapport, which is essential for any doctor-patient relationship.
It's amazing how these top tips touch on so many different aspects of the exam, from the technical to the interpersonal.
Right.
They're like little nuggets of wisdom that can help you become a better examiner on every level.
I agree. And there's one more tip I want to highlight before we move on.
Okay.
It might seem obvious, but it's often overlooked.
Okay.
The importance of listening to your patient.
Listening. Isn't that a given in any medical interaction?
You'd think so, but it's easy to get caught up in the technical aspects of the exam and forget to really hear what the patient is saying.
So it's not just about asking questions, it's about actively listening to their answers.
Right.
Paying attention to their nonverbal cues as well.
Exactly. Sometimes the most important clues come from what the patient doesn't say,
Right.
or from their facial expressions or body language.
Right.
A skilled examiner will pick up on those subtle signals and use them to guide their exam.
I can see how that would be especially important in abdominal exams, where pain and discomfort can be hard to describe.
Absolutely. A patient might not be able to pinpoint exactly where it hurts, or they might downplay their symptoms.
Yeah.
But if you're paying attention to their nonverbal cues, you can often get a better sense of what's really going on.
It's like you're becoming a detective of the human body,
Right.
using all your senses to piece together the clues and solve the mystery of what's causing their symptoms.
Yeah, that's a great way to put it. And speaking of detectives, there's another top tip that reminds us to think about the bigger picture,
Okay.
to consider the patient's entire medical history and not just focus on their abdominal symptoms.
So it's not enough to just examine the abdomen in isolation.
Right.
You need to consider all the other pieces of the puzzle.
Exactly.
Their past medical conditions, their medications, their lifestyle, everything.
Exactly. A seemingly minor detail from their medical history could be the key to understanding their current abdominal symptoms. It's all about making connections.
I'm starting to realize that abdominal examinations are much more complex and multifaceted than I ever imagined. It's like you're piecing together a puzzle, using all your senses, your knowledge, and your intuition to figure out what's going on inside the body.
And you're right, intuition plays a big role.
Hmm.
You can learn all the techniques, read all the top tips in the world,
Right.
but experience is invaluable.
Hmm.
The more patients you see, the more you develop a sense of what's normal and what's not,
Right.
and the better you become at recognizing those subtle clues that might point to a specific diagnosis.
It makes sense. It's like anything else in life. The more you practice, the better you get.
Right,
But practice isn't just about repetition. It's about reflecting on your experiences,
right.
learning from your mistakes, and constantly refining your skills.
Precisely. And that's what makes abdominal examinations so challenging and rewarding.
Hmm.
There's always more to learn, more to discover, and more ways to improve.
This has been an incredibly insightful exploration of the art and science of abdominal examinations. We've learned so much about the techniques, the tips, and the importance of observation, communication, and experience.
It has been, yeah.
But I have a feeling there's still more to uncover, right?
You're right. We've covered a lot of ground, but there's always more to explore.
Okay.
In our final part, we'll delve into some real-life case studies and see how these top tips can be applied in practice.
Oh, that sounds fascinating. I can't wait to see how all these pieces come together in real-world scenarios. Stay tuned, everyone, for the thrilling conclusion of our abdominal adventure.
I'm excited for that.
Welcome back to the final part of our deep dive into abdominal exams.
Yeah, I'm excited to wrap up our exploration and see how everything we've learned kind of comes together.
Me too. We've talked about techniques, tips, the importance of observation and communication. It's been a whirlwind tour of the abdomen.
It really has, yeah. But, sometimes the best way to really understand something is to see it in action.
Right, like putting all those pieces together in a real-world scenario.
Exactly. So I thought we could spend this last part talking about some interesting cases where those subtle clues and top tips really made a difference.
Oh, case studies. I love a good medical mystery.
Well, let me tell you about a patient I saw a few years ago. Young woman, early 20s, came in complaining of fatigue and some mild abdominal discomfort. Nothing too alarming at first glance.
Okay, pretty common symptoms. What happened next?
Well, during the initial observation, I noticed something interesting.
Okay.
She had a very subtle yellow tinge to the whites of her eyes.
So a hint of jaundice, that could point to a liver issue.
That's what I was thinking. But her liver function tests were normal, and she didn't have any other risk factors for liver disease.
Hmm, that's a bit of a puzzle. What did you do next?
I went ahead with the abdominal exam, paying close attention to the liver.
Okay.
And here's where those top tips came in handy.
Okay, which one did you use?
Remember the one about starting low when palpating the liver? I started down on the right iliac fossa and slowly moved upwards as she took a deep breath.
And did you find anything?
I did, yeah. Just as my hand reached the costal margin, I felt a very slight, almost imperceptible bump.
Wow, that's subtle. Would you have felt that if you hadn't started so low?
Honestly, I don't think so. It was so small and easily missed if I had started palpating higher up.
So what did that tiny bump tell you?
It suggested that her liver might be slightly enlarged, even though it wasn't obvious on visual inspection. It was just a hunch at that point.
Right.
But it was enough to warrant further investigation.
It's amazing how those little details, those tiny clues, can make such a big difference.
You really can. In this case, we ordered an ultrasound, and it revealed a small tumor on her liver.
Wow. So that subtle finding on the exam actually led to a life-saving diagnosis.
It did, yeah. If I hadn't used that top tip and started palpating lower down, I might have missed that tumor entirely.
That's incredible. It really highlights the power of a thorough and well-executed exam.
Absolutely. And it's not just about the physical techniques. Remember how we talked about the importance of listening to the patient?
Right. Picking up on those nonverbal cues.
Exactly. I had another case, middle-aged man who came in with vague abdominal pain.
Okay.
He was very stoic,
Yeah.
trying to downplay his symptoms.
So he wasn't giving you much to work with verbally.
Not really.
Mm.
But I noticed that whenever I palpated a certain area of his abdomen, he would subtly wince and hold his breath.
Ah, a telltale sign. His body was giving him away, even though he was trying to be tough.
Exactly. That nonverbal cue told me that there was something going on in that area, even though he wasn't consciously expressing it.
Right.
It led me to focus my exam on that region and ultimately led to the diagnosis of a small bowel obstruction.
Wow. So even when patients are trying to be brave or stoic, their bodies can still communicate what's wrong.
They absolutely can.
Yeah.
And it's our job as examiners to be attentive to those subtle signals.
These case studies are fascinating. They really bring all those top tips to life and show how they can be applied in real-world situations.
I agree. They highlight the fact that abdominal examinations are both an art and a science.
Right. It's not just about memorizing steps. It's about using your knowledge, your experience, and your intuition to really understand what's going on with each individual patient.
Exactly.
Yeah.
And I think that's what makes this field so challenging and rewarding.
Well, this deep dive has been a real eye-opener for me.
Yeah.
I never realized how much goes into a thorough abdominal exam.
It's a deceptively complex procedure, but mastering it can make a world of difference in patient care.
And as we've seen, it's not just about the big, obvious findings. Sometimes it's those subtle clues, those little details that lead to the most important diagnoses.
Exactly. It's
Yeah.
all about connecting the dots, piecing together the puzzle, and never underestimating the power of a skilled and attentive examiner.
So to our listeners out there, if you ever find yourself needing an abdominal exam, remember those top tips we've discussed?
Yeah.
And don't be afraid to ask your doctor questions.
That's right.
The more you understand about what's going on, the better equipped you'll be to advocate for your own health.
That's great advice. Knowledge is power, and being an informed patient can make all the difference.
And with that, I think we've reached the end of our abdominal adventure. Thank you for joining us on this fascinating journey.
It's been a pleasure exploring this topic with you.
Until next time, stay curious, stay informed, and stay well.